Advanced Pharmacology, Test 1, Notes, Hypothyroidism. Hypothyroidism, so autoimmune or Hashimoto's thyroiditis is the most common. Subacute thyroiditis, post-radioactive iodine therapy, lithium therapy, iodine deficiency. That's how you get hypothyroidism. Goals: restore and normalize thyroid hormone concentrations, attain and maintain a euthyroid state, relieve current symptoms, reverse any biochemical abnormalities. What agents are used to treat hypothyroid disease? What makes medications different, and what do the guidelines recommend? Recommendation 22.1. Patients with hypothyroidism should be treated with levothyroxine monotherapy grade A. Other forms of thyroid replacement may be associated with unnecessary cost, lack of therapeutic rationale, increased adverse effects, and allergenicity because they are animal-based products. Starting therapy. Normal adult dose is 1.6 micrograms per kilogram per day, which equates to about 100 to 125 micrograms per day based on IBW. Titration by 25 to 50 micrograms every 4 to 6 weeks until TSH normalizes. Exceptions include elderly, chronically ill patients, or a history of cardiovascular disease. Initially 12.5 to 25 micrograms per day, then titrate to the maintenance dose until the TSH normalizes. Expect higher requirements during pregnancy. Thyroid hormone demand, it increases TBG and destruction of T4 by placental duodenosis. How is treatment monitored, and how should the results be interpreted as far as therapy changes the relationship between TSH and T3 and T4? Monitoring should be every 6 to 8 weeks after starting or dose product change. If TSH is not in target range, which is 0.5 to 2.5 milliequivalents per unit per liter, alter dose in 10% to 20% increments. Levothyroxine has a T half-life of 6 to 10 days. How does this relate to the fact that after initiating or changing a dose or changing a product, i.e. brand to generic, generic to brand, or one generic brand to another, TSH should be checked in about 6 weeks? Why are thyroid replacement drugs considered to have a narrow therapeutic index, which is NTI, and what does that mean clinically? This is in red. The therapeutic index is the range of doses at which a medication is effective without unacceptable adverse events. Drugs with narrow therapeutic index have a narrow window between their effective doses and those at which they produce adverse or toxic effects. Bioavailability, it's erratic at 40 to 80% brand versus generic. Highly protein bound, 99%. Half-life, Euthyroid is 6 to 7 days, hypothyroid in 9 to 10 days. Steady state at 6 weeks or 4 to 5 T1 halves. This is the basis for monitoring at 6 weeks from start or changes. Consider changes such as brand to generic, different generic manufacturers, different pharmacies, etc. Any such change will require repeat lab monitoring at 6 weeks to confirm the same clinical response. What are some drug to food interactions associated with thyroid replacement, such as drug binding interactions, divalent catations, amiodarone, certain antibiotics? All patients should be educated that thyroid replacement should be taken first thing in the morning with water only and at least 30 minutes away from food or other medications. Where binding interactions are concerned, the window is a 2-hour separation. Drug to drug interactions. So impaired absorption is cholestyramine, calcium carbonate, sulfourate, aluminum hydroxide, iron sulfate, or fiber. Binding competition is anticonvulsants. Increased metabolism is rifampin and sertraline. Block conversion of T4 to T3 is amiodarone. Decreased distribution, digoxin. Increased bleeding, warfarin. Hyperthyroidism. So Graves' disease, most common. Nodular thyroid disease, toxic solitary or multinodular goiter. Inflammatory thyroid disease. Goals: reduce the activity of excessive hormone activity, minimize symptoms. The medications are thianomides. Recommendation 13. Methimazole should be used in virtually every patient who chooses anti-thyroid drug therapy for GD, except during the first trimester of pregnancy when propyl thiouracil is preferred. In the treatment of thyroid storm, inhibition of peripheral conversion, and in patients with minor reactions to methimazole who refuse radioactive iodine therapy or surgery. Delayed onset. Monitoring LFT, CBC, TSH, free T4, and weight. Drug to drug food and drug to food interactions. Iodides, radioactive iodine, which is RAI. Instructions for patients receiving RAI. Do not kiss, exchange saliva, or share food or eating utensils for 5 days. Your dishes should be washed in a dishwasher if one is available. Avoid close contact with infants, young children under 8 years old, and pregnant women for 5 days. You can be in the same room with them. If you have an infant, no breastfeeding is allowed. Flush the toilet twice after urinating and wash your hands thoroughly. If a sore throat or neck pain develops, take acetaminophen or aspirin. If you know increased nervousness, tremulousness, or palpitations, call a physician. Beta blockers' role in therapy. So beta blockers are used for symptomatic relief of hyperthyroidism until more definitive therapy is instituted and thyroid levels return to normal or near normal. Reduction of peripheral manifestations, tachycardia, sweating, severe tremor, nervousness. Inhibition of peripheral conversion of thyroid hormones at higher doses, propranolol only. Small therapeutic effect and magnitude, thyrotoxicosis. Why does amiodarone pose a unique concern in thyroid disorders? Amiodarone, normal thyroid autoregulation, is lost because of the relatively high iodine content. This fact can lead to a situation where amiodarone can cause both hyper and hypothyroidism depending on the patient. Through several processes, blocking thyroid peroxidase, blocking proteolysis of TG and thyroid hormone, altering organification, etc.